Hi, my name is Jennifer Arhen, and I am a student at Eastern Kentucky University in the Psychiatric Mental Health Nurse Practitioner program. I am doing a presentation today in NSC 890 on cognitive therapy being implemented as an intervention for depression with suicidal ideation as compared to other interventions in adolescents and adults. Suicide rates continue to increase, and according to the Joint Commission website, it is now a national patient safety goal to decrease the number of suicide and suicide attempts. Many studies have been completed to explore methods that will be effective in helping to decrease the number of suicidal attempts. Suicide is completed or attempted when an individual feels they can no longer deal with pain and mental despair, and they give up hope of living a happy life. Therefore, the individual commits an act to end their own life. There is a known connection between depression and suicide. Signs and symptoms of suicide risk would be talking about wanting to die, making plans to kill themselves, feeling unbearable pain, withdrawal, giving away important possessions that they may have, a change in their normal patterns, and displaying extreme mood swings. Cognitive behavioral therapy is a type of therapy that is used with patients suffering from mental health disorders. It can be used as a standalone therapy or also with other therapies together. CBT poses no side effects as other therapies such as medications could cause. CBT can be used to treat a variety of mental health issues. Some disorders that may improve with CBT include sleep disorders, depression, bipolar, anxiety, substance abuse, schizophrenia, PTSD, and phobias. Risks associated with CBT are very small. They are usually due to exploring your feelings and facing reality of your issues. Patients may experience anger, crying, feelings, emotions, or just feeling drained. There was 2 studies that I reviewed for my integrative review. This first study was a randomized controlled trial to find the incident of treatment-emergent suicidal ideation over 4 months with the use of SSRIs or CBT or interpersonal psychotherapy. The study found that both the SSRI group and the therapies were valid and safe treatments for patients with depression. However, the group designated to the SSRIs had side effects that the CBT did not have. So in fact, if using the CBT alone was just as effective but does not result in any side effects, CBT alone could prove to be the better intervention. The second study conducted was a clinical trial of 30 adolescents who had previous attempts of suicide within the last 3 months. The individuals also had feelings of hopelessness. They were between the ages of 12 and 18 years old. This study found that of the 30 patients in which all completed the study, the difference in suicidal ideations were significantly different at about 3 months of treatment, and the intervention of CBT decreased the thoughts of suicidal ideation and hopelessness feelings. Also, the CBT had showed that they had improvement in their school activities. So how can CBT improve practice? Incorporating CBT into practice could help decrease the amount of suicide and suicide attempts. Exposing mental health patients to these experienced professionals can help teach new ways to cope with stressful situations and allow for more healthy coping strategies that will support a healthy mental state, in return decreasing the risk of suicide. CBT also does not pose any great risk for side effects, which could lead to patients not wanting to continue with their treatment. So for new interventions, patients seeking treatment for mental health disorders see their physicians on a regular basis to discuss and make changes as necessary. Once a patient is identified at a higher risk for suicide, the patient should then have CBT initiated within 24 hours of that assessment. At a crucial time when patients are experiencing the suicidal ideations, that is when the CBT should be incorporated quickly to prevent this from happening. This group will allow highly trained professionals to listen to the patients, provide support, and come up with emergent coping mechanisms to guide them through their hard times. Sometimes just having support for the patient and someone to listen to them proves to the patient that there is help and other healthy ways to respond to the mental issues that they're having at the time. This intervention could be placed within mental health care outpatient facilities that are treating patients for depression with suicidal ideations, implementing CBT within a 24-hour period from having suicidal thoughts or a significant increase in depression. This type of intervention could be accessible for all outpatient mental health treatment facilities that treat patients with depression. So in conclusion, I would just like to say that I feel that the use of CBT is a good alternative for patients that have depression with suicidal ideations. There is no side effects associated with the use of it as compared to many SSRIs that do have side effects, and some of these can stop patients from wanting to continue with treatment. And thank you for watching my video, and please feel free to ask any questions or leave any comments.